Hello, it's Dr. Shelley, and guess what? This video is for those of you who just failed the NGN NCLEX exam, or the HESI, or the ATI, or the old test, and you're scared to take this one. Because listen, I've got something to tell you. I am making this video so that you never fail the NCLEX again, ever. Also, I'm going to offer 5 critical strategies to help you plan for this next test. The first thing that I wanted to show you, because it made me want to do this video, I have noticed that my students that are coming in to register for my class that failed the test are showing me their Board of Nursing reports, the NCSBN report that you get when you fail, and that report was mind-blowing because it's completely different from the report you may have gotten from the NCLEX if you failed it when you took the old test before April 1st. So I want to show you this because it just goes to reinforce why it's so important for you to know some of the tools that are at your disposal through my HETV YouTube channel and how to utilize them for totally free, okay? So I'm going to come up a little closer to show you this report that my student brought in. If you look closely, one of the #1 topics of failure before there was ever an NGN NCLEX is basic care and comfort, and sure as shit, she failed it. She got a below. I want you to know that's #1. And the reason why you care is because the nursing schools today are not teaching basic care and comfort, and even though it's only 9% of any test, and that has not gone up or down with the new test or the old test. Even though it's only 9%, it is the #1 area of failure. So we're gonna work with you to get you to pass that section. But that's not what I'm talking about. I'm telling you that this report blew my mind when I saw this on her report. If you look closely, this says clinical judgment, and they are grading you overall. This young lady did well. And then the 6 pieces of clinical judgment are also graded individually. So the recognize cues, the analyze cues, the prioritize hypothesis, the generate solutions, the take action, and the evaluate the outcomes are literally being graded. Now, you already know how this is going to go. You know that on my HETV YouTube channel, it's organized by playlist, and all of my videos that I've been doing since the new test came out are literally organized with clinical judgment. So let me talk to the nurse who failed NCLEX, because I am helping you never fail again, and all the things on this board are going to help you pass this test with 5 critical strategies. #1, strategy #1 to help you never fail this test again is review the NCSBN report. Now, you guys are adorable. I've had you tell me you threw that shit away. I had you tell me you burned it for firewood. I've had you tell me that you swallowed it and then threw it up as emesis in emesis basin. I've had you tell me that fuck that report. I don't give a shit. No, you give a shit. So let's go over here and check out what this report is trying to tell you. First of all, it used to come in this big yellow envelope. Now it's going to be an email. It's going to come from the NCSBN in the form of an email. If you're taking a review course or you're working with me, I need to see that report. I can definitely help you strategize if you just show me that report. And remember, consultations are like $25, so I can get you all organized if you just text me, email me, something. So let me just, before I forget, because I always do, put my number down, 216-410-0936. That's my phone number. And then CHELLYS NCLEX PREP @gmail.com is my email. And if you're already a member through our membership perks, you already know that you're going to get discounts out the wazoo. So that's for you. But for now, stay with me. 216-410-0936. CHELLYS NCLEX PREP @gmail.com is my email. And if you're already a member through our membership perks, you already know that you're going to get discounts out the wazoo. So that's for you. But for now, stay with me. 216-410-0936. You get this report, you review it. If you look on the report, it's very small, super tiny. I want you to see how tiny it is. Actually, yes, it just says test plan. Then it goes into great detail. That's the part you care about the most. But when you first get your report, it's going to have your picture that you took that day, and it's going to have how many questions you actually took. Let me say something about the questions. You can have anywhere, no matter if it's RN or LPN, between 85 and 150 questions. If you failed in 85 questions, I want you to just be reflective of that and know that you killed everybody, honey. I know it's sad. You can cry later, but right now we're about to strategize and pass this test. You killed every Tom, Dick, Harry, Sue, Jane, and Mary. They dead. We can't even revive them. CPR ain't gonna work. How do I know that? Well, here's our problem. When it comes to this number, they throw out 15 questions. So they throw out 15 to 25 questions, but for sure 15 questions are going in the garbage. So if you take 15 questions from that, that means you actually failed in basically 70 questions, which means you killed everybody for sure. And it didn't take the test long to kick you up out of there and say, girl, bye. What about if you failed in 150 questions? Then you are someone who needs to look at the fact that you almost passed, but not quite. And you may not need as much work or as much help as someone who failed in 85. Now don't get it twisted. You can fail anywhere in between there, 149, 86, 112, 130, it don't matter. But what I'm trying to tell you is that polar opposites do mean something on this report. You failed in 85, you need a lot of help. You knew nothing. If you failed in 150, they were this close to having you become a nurse, and then, it didn't work. Okay, so you don't need as much work as the next person. That's important when you decide what to do to pass the next time you take this test. The more you take it, the worse it gets. Let me explain. I've had people say, well, I don't know. Do you think it gets harder? It's debatable whether or not it gets harder. Here's what I do know after doing this for 20 years. When you've taken this test twice, 3 times, 5 times, 6 times, the highest I've ever had in my class was 11 times. When you've taken this test that many times and you show me your reports, what do I notice? They get worse. Yeah, I want you, if you failed more than once, to look at your reports. Most of the people will tell you, I got worse. That's because you didn't know what to study. And the longer you go away from the actual nursing school, the more time that you take away from nursing school, you don't get smarter, you lose that memory that they put there for some of those concepts, okay? My favorite is when you look at the report, and I want to show you this. There are going to be 3 values, and I'll show you this right here. If you look at basic care and comfort, she got a below. However, if you look at some of these clinical judgment cues and you go down to the one that says prioritize hypothesis, generate solutions, take action, and evaluate, she got aboves. But then if you look at recognize cues and analyze cues, this student got nears. Very important. How do you get an above? Well, practically every question they gave you in that category, you got correct. How do you get near? Well, you got some of the dummy down questions correct, but then when they stepped up the complexity and the level of education needed to get that question correct, you dropped down. So you understood enough where they knew you knew something, but then once they raised the level of difficulty, you fell back down, because this is a computer adapted test. The below means you had very few concepts correct, on this exam. So when a student tells me, I almost passed, I got all nears on my report, I help them gently by saying, no. No, the person that almost passed got most aboves and just a couple of nears. Not all nears. All nears is not almost passed. So please stop thinking that, because it's just not true. I've gotten students who took that test and they got all aboves and one below, or most aboves and a couple of nears. Those are the students that almost passed, not I got all nears. No, where's your aboves? Where is the fact that you mastered a subject or two? If I don't see that, I know that you need a little bit of extra love and support, and I'm here to give it to you. Now let's look at the categories. You guys know this new next generation NCLEX exam that you will never fail again after these 5 critical strategies. When you look at this report, which is strategy number 1, review the damn report. When you look at this report, they give you all these subjects. There's 8 of them total, but I wrote down just a few because I wanted you to focus on the most important. And I want to say the last thing you want to do is look at 1 or 2 categories on the report and focus all your studying in that category. They're not going to give you that category like that no more. No, they're not. And so you just wasted your time. But I do want you to focus on what I'm saying in terms of the percentages and who fails what the most. Number 1 area of failure, like I said, was basic care and comfort. And there it was, the student that I showed you her report, boom, below. Why? What is basic care and comfort? I could go around any class and ask, what is basic care and comfort? And probably only 2 students could really tell me. Because nowadays, we go through nursing school like it's a microwave instead of a crock pot. And I say that because there's so many different ways to become a nurse. There's the bridge program. You were an LPN, get in this little 18-month program or 10-month program, and we're gonna make you an RN. There's the 2-year RN. Come on in here in 2 years or less, we're gonna make you an RN. There's people that got a bachelor's degree in something else and can go and get an associate's or a bridge program in nursing and become a nurse just like that. Others may be, like myself, went to school the whole 4 years. A traditional way of getting a degree, the baccalaureate, the bachelor's in science of nursing. I've got to tell you, education is power here. Because when I graduated from my 4-year program with the bachelor's in the science of nursing, I may not have been great at the skills of nursing, but I certainly knew the concepts of nursing, like basic care and comfort. So I'm hoping you write this down, because you got to know these. When it comes to basic care and comfort, I'm going to give you a ton, okay? It's the cough and deep breathe for the post-op patient. It's the increase your fluids and green leafy vegetables and move more for constipation. It's the aromatherapy for anxiety. It's the warm compresses for sickle cell. It's cool compresses for fractures. It's positioning in the bed for comfort. It's diets and nutrition. It is ambulating after a C-section. It's all of those basic care and comfort things that you want to remember. The problem with those programs that took 10 months, 18 months, 2 years, LPN, bridge, the problem with those programs, and I'm not mad, it's just that you need a little bit more love in those subjects. The problem with those programs is they focus on the critical, right? They focused on the trachs, they focused on the vents, they focused on the disease process, they focused on the medications to treat it, they focus on signs and symptoms and risk factors and all this stuff. side effects. They did not focus on how do you do nursing better than anybody else. How do you approach the patient, not like a doctor with a medication, not like a pharmacist with a medication, not like a doctor with a procedure and a disease test, diagnostic test, not like a physical therapy. No, how do you do what nobody in the world does? Part of what you do is teaching. Teaching is a big part of basic care and comfort. Okay, so number one area of failure. Now, you stay tuned because I'm going to be making a video on just basic care and comfort to hook y'all up. But for right now, know it's the number one area of failure. On your NCN SBN report, the way you never fail again, is to understand that this NGN NCLEX has way more safety and infection. Infection control, precautions, your isolation concepts, your PPE, even your antibiotics, your understanding of sepsis, your bioterrorism, all of that is huge. And they put more on the new test for a reason. You see, the reason why they decided to put more infectious disease on the new test is because y'all acted like a fool with COVID. Oh yeah, you lost your mind. You thought there was microchips in the damn vaccines. You was all on Facebook and Instagram sharing fake news. You lost your mind. And they thought, oh my God, our nurses have lost their mind. They don't even know basic science or microbiology. We better focus on this in the future so that they teach and love on their patients in such a way to prevent infection. Okay. I want to show you something. This infectious disease packet that I offer my students is thebomb.com. In fact, if you look at the first page, I have literally put all the infections you need to know in this list. I've given you all of the actual precautions. I put the antibiotics in here. I put the sepsis information in here. I put how you put on and take off your PPE. I have the resources you need. And you need to know infectious disease better than you know it. It's 13% of your test. And when I teach it in my program, I make sure I incorporate other concepts to make it a full 22%. The next category of failure. So what do we have? People fail basic care and comfort the most. Safety and infection, the second most highest failure area. And reduction of risk. Now that whole $4 words don't mean nothing. So what is reduction of risk? Here it is, procedures. Procedures is reduction of risk. So in this procedures packet, I have everything. So if you look, I have your basic procedure information. I have your anesthesia, analgesia. I have trach care. I have your everything, really. I have your feeding tubes. I have everything you need. I even have EKGs in this packet. I have pictures of positioning. I have your diets and nutrition. I have this for you. And the problem is, when you take this part of the test and it's already 12% and you don't know your procedures, for example, you don't even know what a sitz bath is. You have no idea what an ERCP is, or an endoscopic retrograde pancreatography, like you just don't know what that is. Or you don't know what an MRE is, or an EEG is, or the difference between MRI and CAT scan, or medication administration, especially sub-Q injections when a patient's BMI is greater than 25, all of which are focus areas on any test. That's what that procedure packet is for. So this is a big area of failure. Management of care, delegation, prioritization, precautions and roommates, who do you see first, ethical legal concepts, all of which are right in here. So your management of care, this management of care has the DNRs, the advanced directives. In fact, I just want to show you a little bit of the table of contents with this stuff because this is huge. Do you know the difference between hospice and palliative care? Are you aware of workplace conflict and how to handle it? Do you know how to do your SBAR? Are you understanding what informatics means? Do you know therapeutic communication versus non-therapeutic communication? Are you up on your ethical principles like beneficence, non-maleficence, advocacy, your fidelity, your paternalism, your autonomy? Are you aware of what risk management is? Do you know what the difference is between a sentinel event and a serious safety event? I mean, you feeling me that? That's all in there. Guess what percent of your test this is? 18%. The highest category of concentration of questions is management of care, okay? You cannot sleep on pharmacology, and I often couple it with psych. But let me say something about pharm, because as you can see, pharmacology is 16%, psych is only 9%, but I combine the two of them because here's our issue. When it comes to pharmacology and psych, 75% of the medications on NCLEX are psych meds. The other percent are cardiac meds. So you cannot take this test and pass it without understanding the combination of psych and pharmacology together. Why do you think it is that UWorld has a special section on their software that says psych meds? And I would suggest you learn all 35 of those psych meds. Now, what did I say we were doing? We're never going to allow you to fail again. We are giving you 5 critical strategies. I just reviewed the report for the categories and the percentages they are on your exam and how you might get an above, a near, or a below in these categories. Also, you got to come with me because when you review this report, like I said, at the bottom of the report is your clinical judgment. And your clinical judgment is huge. So, you know, if you slept on some of the newer concepts, don't worry. You have to know these. They did a good job of explaining what they are. So let me just go ahead and tell you what they wrote on the report. When you think about recognizing cues, this is how you're looking at vital signs, the medical history, your patient's age, any kind of risk factors, environmental concerns, blah, blah, blah. When you're analyzing the cues, you are taking the cues that you recognize and you're putting a meaning to them based on the case study. Let me explain. If you recognize the cue that the patient in the case study was 16-year-old female, the analysis of that cue is that she's childbearing age, number 1. Number 2, she's not able to give informed consent. She's a child. Number 3, you have to incorporate growth and development as you manage her care, and the growth and development stage that she's in, the Erickson growth and development stage she's in, is identity versus role confusion. Now you would admit those two are totally different. Recognition of the cues, 16-year-old and a female, to the analysis of the cues, okay? When it comes to prioritize hypothesis, this is taking what you think the patient has in the case study and ranking it in order of prioritizing, as well as recognizing how it's different from other conditions. So a good example of that is knowing the difference between ulcerative colitis and Crohn's. knowing the difference between venous insufficiency and peripheral artery disease, knowing the difference between intermittent claudication and a DVT. That's an example, prioritizing your hypothesis. When you look at generate solutions, this is how does the nurse incorporate her plan of care and include a little bit of SBAR in there. So generating solutions, which is the fourth category of the clinical judgment, is basically your precautions, so bleeding, ICP, seizure, infectious disease precautions, neutropenic precautions. Those are your precautions. They're basically, what do you plan on doing with this patient? Maybe genetics counseling, maybe whatever. So it's a plan of care. Some of your basic care and comfort is in there. Yes. Okay, now take action. This is kind of easy because a lot of students do well with take action because all these nursing schools out here taught you how to take action. They just didn't teach you how to make the patient comfortable. So take action, start the IV. Take action, prep her for surgery. Take action, make sure you put an ID bracelet on her. Take action, make sure you go ahead and do that wound care. Take action, position the patient in high fowlers for respiratory distress. Take action, suction the trach patient. Okay, take action, right? So you know how to take action. They taught us that. But then lastly is evaluate outcomes. And how do you know if the patient is getting better or worse? Now, before, in one of my case studies earlier, one of my lectures on sickle cell, I told you they let an 8-year-old die. Now I just found out today they let another young lady die. In fact, the police took her out of the emergency room. She went there on Christmas Eve, was dead by New Year's Day. This is crazy. She begged for care, and sickle cell is no joke. So how would you know that the patient is getting worse? This is evaluate outcomes. Your first step in never failing your NCLEX again is to read the report that they gave you. If you need my help, please call me. I will help you know how to strategize for the next test. Like I said, consultations are 25 bucks. Here's one that you might not like too well. Some of y'all are just too nice. You're nothing like me. I have my issues. I'm not too nice. That ain't one of them. But you are. You just grew up nice. You know, you got trained the right way. You're just a lovely little person. The problem is you're too lovely. You need to be selfish. What did I tell you? I told you, if you're working 40 hours, I get it. I used to work 50. But you're going to have to find a way to cut back a little bit. If you can't, because it's unreasonable, for me it would have been, then you got to cut back in other ways. In terms of being selfish, why did you think that you should volunteer to make the chicken for the church? What kind of shit is that? God will forgive your crazy behind if you don't make that chicken. Stop volunteering for everything. Why did you think you could be the PTA chair the same year you trying to pass your NCLEX? Why did you sign Baby and Shay Shay up for 3 activities each after school and you know you the taxi mom? Why did you think that you could have you a husband and a flavor of the month and please them both? That's another class. Why did you think that you could be the only sibling out of all your brothers and sisters to take over cooking mama dinner? None of this is working for you. You see, the way you know you're doing this right, the way you know that you got point number 2, the critical strategy number 2 right here, being selfish, your mama and them took you out the will. Your man filing for divorce. Your kids have called 696 Kids and reported you because you made peanut butter and jelly every day. Now you're on the right track. Stop doing too much. Your focus is NCLEX. I promise you, when I passed my NCLEX, my kids got lucky, honey. They have never seen so much happiness because I am now a nurse and can do a lot more with them with the daggone degree than I can sitting on my butt talking about I failed the 3rd time. Strategy number 3. Remember, I promise you, you was never going to fail again, but you got to listen to me. So strategy number 3, Stop thinking questions are all you have to do. It's all bullshit. You must study content and you must take notes on the content. Now, how do you get content? I'm good. I don't even know that I'm the best. I like to think I am, but not necessarily when it comes to YouTube. You got 4 or 5 of us that's the bomb.com. And in my particular case with my content, it's organized. It's organized in playlists. If you go straight to playlists, you can find any subject that you want, but you're gonna have to take good notes and study your notes or get the handouts that I have or something. Now, look at this. You cannot be all over the place when you study content. You must start with one subject at a time. And I do give you the list in the free, remember, I give y'all this free Oh My God packet. I ain't charged y'all nothing. I just send it right to you. This has how you do all that, okay? It even has the subjects you got to master, and the videos and everything are for them. You got to do one subject at a time. So here's the deal. Pull up the video. Take the notes. Pull up your UWorld. Do a test. No more than 5. Here you go. Category, strategy number 4. No more than 5 to 25 questions every day, all day. When you do more than 5 to 25 at a time, when you do 68 and 42 and 85 and all this, you are not going to remember not one of those questions. You're never going to be able to review the rationales, and you must review the rationales. So keep your bite size small, 5 to 25 questions every day, all day. And here's the thing, guys. You've got to work yourself up to 300 to 500 questions a week. By the end of the week, you should have counted in your little UWorld the fact that you did all these questions. But none of the questions matter if you ain't doing the content. I got a student on this side of the table, students on that side of the table, student back there at that side of the table. All of them did questions. None of them understood content. They went to school during COVID. They got fucked up clinicals, if any clinicals. Some of y'all ain't getting no clinicals. You just did simulation. You know your ass needs some content. I'm sorry, you might get mad at me. But the 5th critical strategy for how you're never gonna fail NCLEX again is to practice your case studies. You have to understand how to whip that clinical judgment out and practice that case study. Now, it is hard because it's so new that there's not a lot of resources with case studies in them. But I'm going to start sharing case studies this Sunday. So you're gonna get case studies starting every week, starting this Sunday. I want you to hang in there. You can do this. You will do this. You ain't got no choice. This test, you gotta pass this test. Don't act crazy now. You need your money. You need your success. You need to keep the faith, and you need to pray about it. If you're a spiritual person, you got to understand you can't do this alone. You can't. You need a higher power. And for me, that's God. It might be Allah for you, Buddha, whatever. I don't care. I need you to pray. Get it together, and let's tackle this test. Now, I have a treat for you. If you watch this video and you liked this video and you contact me in the next, are you ready for this? In the next week. So today till a week from today, I will hook you up. Now, what's the deadline to get hooked up? The deadline to get hooked up is the 26th. No, I lied. The 27th of June. Hook up. What does hook up mean? Let me show you. Pharmacology with the medication categories, with infectious disease, with procedures, with management of care, with the psych meds, and the complimentary already free Oh My God packet will be yours for $50. After that, I'm sorry y'all, it goes up to $75. So hit me up, let me hook you up and get you together and get your license. Deuces. Love y'all.